Hello and a very good evening to one and all. Shubho Shundha. I am Ornob on behalf of Diabetes Awareness and You, Department of Food and Nutrition, Udaynarayanpur Madhabilata Mahavidyalaya, Howrah and Asansol Girls College, Asansol, welcome you all to this one-day national level webinar to observe the National Nutrition Month 2025. Today's session is going to shift the paradigms. I'm telling this with a confident after the end of today's session, the many of your perspectives are going to transform. The brother of the first global citizen of this country, Swami Vivekananda, notable anthropologist Dr. Bhupendranath Datta, in his research showed Indians, both Aryans and non-Aryans, were not stunted. But it was the prolonged colonial rule and policies which made the Indians stunted. Bengal witnessed famine and other atrocities, but India has the tradition to emerge from every single atrocities using the power of tradition and innovation. So it is time to welcome one of the paradigm shifters in diabetes management and education program in India, across the Indian subcontinent as well, the founder and secretary of Diabetes Awareness and You, Sri Indrajit Mojumdar, who has been instrumental in shaping the strategies to form advocacy measures at grassroots level. He is one of the pivotal person in transforming laboratory research useful for marginalized, and he and his team developed Diabetes Awareness and You. The organization is breaking the barriers for the betterment of the community. It is great honor to welcome Sri Indrajit Mojumdar to inaugurate today's national level webinar to observe National Nutrition Month 2025. Sir Indrajit Mojumdar, sir, please welcome to this virtual platform and please inaugurate by giving your speech about today's National Nutrition Month 2025. Sir.
Thank you, Dr. Arnav, for your kind words. Good evening to all of you who are watching this today, your Facebook Live. A warm welcome on behalf of Day, Diabetes Awareness and You to Subba sir, Snehashi ma'am, and Dr. Arnav also, and who are joining this today. Obesity is a major concern for the policymakers nowadays. Few days back, our Honorable Prime Minister have also raised the issue. The obesity is now a major threat to our Indian subcontinent, or Indian peoples. So, today's discussion or topic is very pertinent for today's world. And from our organization, we always keep that discussing all the burning topics, issues, and as well as in our policy advocacy field, we are doing our effort to change the policies. And today we have with us Dr. Subba sir. Sir, welcome, sir. And taking this opportunity, I would like to also congratulate you to get the PG Tulpule Oration Award. Today, the National Institute of Nutrition has declared this award goes to Dr. Subba sir. Congratulations, sir, on behalf of Day and all of us. And sir, we are eagerly waiting to hear from you regarding the topic. And we have our moderator today, Dr. Arnav. So we will enjoy the session and definitely we'll get some important directions from today's session. And once again, I will also welcome in all of you. So now over to Dr. Arnav. Thank you.
Thank you, Indrajit sir, for your kind words and inaugurate this session. And now it's a great moment to welcome sir. Before that, I would like to say the idea of Shantiniketan and Vishwa Bharati was conceptualized by Rabindranath Tagore. But in that organization, Kaviguru had a trusted companion, Professor Khiti Mohan Sen, a notable professor of Sanskrit and a paradigm shifter who nurtured Vishwa Bharati to become a world-class institute. His grandson, Bharat Ratna Nobel laureate Professor Amartya Sen, inherited that character of his grandfather. He established the power of human capitals in economic research, which transformed the entire nutrition research as well. The power of proper policies to bring substantial changes in community depends upon the proper evidence-based empirical research. Now, we are going to listen a lecture from the most influential paradigm shifters of nutrition research, one of the most prominent face of nutrition research at the global arena, encyclopedically knowledgeable and incisively empirical, our teacher, mentor, and guiding star of many dreamers who believe nutrition science and research is a tool to lead our country towards the great vision 2047 Viksit Bharat. Pioneer in nutrition communication research, especially on food levels, member of FSSSI expert panel, secretary of Nutrition Society of India, the largest organization of nutrition fraternity in India, fellow of International Union of Nutrition Sciences, scientist F, head Nutrition Information Communication and Health Education Department, ICMR National Institute of Nutrition, Hyderabad, the favorite mentor of MSc and PhD students of ICMR NIN, Dr. Gavaravarapu Maruti Subbarao, sir. Sir, we welcome you to this virtual platform from Kashmir to Andaman Nicobar, and Arunachal to Gujarat. The entire nation is waiting for your lecture to hear from you about the policymakers' perspective in this occasion of National Nutrition Month 2025. We welcome you once again, and it's a great honor to welcome you to this virtual platform, which has been organized by D and Udaynarayanpur Madhabilata Mahavidyalaya and Asansol Girls College. Sir. Sir, can you hear me? I think some technical error happened. Just wait for some time. Sir is going to connect again.
Yes, I think please stay with us. Uh, some technical problem is there, sir, left out. So today's on this occasion, no,
Yes, sir.
I also like to inform you all, to all the audience that Day is always working towards the betterment of life. And Syed, today we are very fortunate that Syed is here with us because policy making is most important thing. After Syed has joined again.
Sir. Yes, as I think some problem happened from sir's end. He's trying hard to again connect with us. So as you know, means uh, sir's role is pivotal in food leveling, especially read before you eat the concept and the sugar board, which is a great idea which is going to be implemented across the canteen of Indian education institutes and major government institutes
Yes,
to
yes.
check. Hmm,
Already CBSE has implemented it in their
hmm.
schools, and
Yes,
ICIC also is thinking about it.
yes, and then rest of the state government institutes are going to implement that because it's a great
Yes, yes,
informed choice that whatever we are consuming, whether what we are truly consuming, it is nothing. There is a famous say that pani bujhaye pyas, baki sab bakwas. So it's
mm,
except the water, all others, this beverages which is being sold to us to to make us energized or something which is not useful for us and which is a unhealthy food stuff. So and the SIR's role was pivotal. Their group niche, that is nutrition information community communication health education, their group is they have been advocating about the front level packaging of the foods and food safety measures and different nutrition profiling work because in developed countries, European standards or in American standards, there are informed choices like the which sort of food you are consuming, whether it is a high calorie food or high salt or high sugar food,
yes.
that you will
High
come
salt.
to.
That is
Yes,
That is
okay.
very important because in our country, the hidden salt we are consuming, we cannot generally cannot calculate the hidden salt we are consuming. So excess salt is another issue so we should address there. And the sugar consumption. In England, there is a rule say you cannot take sugar more than Sarah's joint. Yeah, yeah. So
Okay.
welcome
I'm
back.
so sorry. A very unstable connection that I have got. I'm extremely sorry for the technical glitch. I tried connecting even from my neighbor's Wi-Fi. That also did not work. Nevertheless, I hope this works for a while.
Yes, sir.
Before
Yes, sir.
we take data runs out. Thank you for that very kind introduction, Arnab. I don't deserve much of what you said, but I'm very happy that I'm able to speak to the audience, which is led by the Bengal group, which is one of the highest number of contributors for our MSc strength year after year, and also PhDs. And we're very happy that many budding researchers and well recognized researchers are from Bengal. Unfortunately, being the convener or being the secretary of the Nutrition Society of India, I'm unhappy to say that Bengal doesn't represent itself as a chapter in the national activities. There used to be very vibrant Bengal chapter long ago, I think about 20-30 years ago. But now we do not. I request all of you, and especially my student groups and also their guides, to please come together to form a Bengal chapter for NSI, and then please take it forward. It's where a lot of human resources in nutrition comes from, and it is unfortunate that it is not represented. NSI is not represented in that land. So that's the first thing that I wanted to say, and then I'll just go ahead with the topic that's given to me. Arnab also suggested that there are a lot of people joining from around the country. To keep it fairly easier for everyone, what I'll try to do is I will try to speak both in Hindi as well as in English. I can manage a few other South Indian languages, but too much of a khichdi is good for health, but not good for understanding. So I will try to just address the topic that's given to me. He asked me to speak on HFSS and its importance, reducing HFSS and its importance in combating the growing overweight and obesity. And he wanted me to take a policy perspective. Policy perspective, I will try and share from what is uh, what translates from science to policy. The main thing being the dietary guidelines. I'll keep my focus largely on the dietary guidelines for Indians, which is a recent document brought out by NIN. And I will hint at only the obesity and HFSS related factors in that. And then I will come to the important policy directions that are there. But I'm afraid I'll not be able to cover all the policy related things, because to promote nutrition, you need to know economics, you need to know agriculture, you need to know women welfare, you need to know gender policies, you need to know health, you need to know non-communicable diseases, you need to know science, you need to know a lot of infrastructure. And every ministry, to my knowledge, has a role to play in promoting nutrition. If you see from the policy perspective, at least 13 to 14 ministries, that means 13 to 14 sectors, including transportation, civil supplies, economics, consumer affairs, everyone has a role to play in promoting nutrition. To expand all that, perhaps it will not be possible in the half an hour lecture that I am going to address today. So I'll keep it short and then keep it very understandable to everyone. इधर से मैं आगे बढ़ूंगा ओबेसिटी और HFSS फूड्स के बारे में समझाने के लिए, इतना कि मैं पॉलिसी एंगल बहुत सारा ले नहीं पाऊंगा. मैं डाइटरी गाइडलाइन से शुरू करके पॉलिसी के अर्जेंट मेजर्स जो है, जो भी हमें बताया गया है, उसमें थोड़ा ध्यान देते हुए मैं क्लोज करूंगा. तो पहले अर्नब, कैन आई मूव द स्लाइड, नेक्स्ट स्लाइड प्लीज. सो पहले ये दिखाऊंगा कि मैं आपको 2017 का ये स्टैटिस्टिक्स है. आप अगर ये दोनों डायग्राम्स देखेंगे, उसमें ऑरेंज और ब्लू वाले सेगमेंट्स पे ध्यान दीजिए. इफ यू लुक एट द ऑरेंज एंड ब्लू पार्ट्स, they talk about what India was in 1990 and what India is in 2016 in terms of DALYs. DALYs का मतलब होता है disability adjusted life years. इसमें दोनों भी morbidity और mortality दोनों भी लेते हैं, जैसे कि डिसीज कंडीशन और डेथ्स, और दोनों भी उसमें आई मीन वेगली स्पीकिंग उसमें दोनों भी आते हैं. आप अगर 1990 का चार्ट देखेंगे, आपको पता चलेगा कि मैक्सिमम डैलीज और डिसेबिलिटी एडजस्टेड लाइफ ईयर्स वर ड्यू टू कम्युनिकेबल डिसीजेस, जैसे कि इन्फेक्शियस डिसीजेस और थोड़े मैटरनल एंड नियोनेटल डिसीजेस भी. जाते जाते सिर्फ 30 साल में, from 1990 to 2016, in just over 3 decades, you have seen, not even 3 decades, you have seen the blue curve taking over, meaning non-communicable diseases बहुत ज़्यादा बढ़ गए हैं. So next slide, please. Keep going. Keep going. This is a slide that I always show for the last 10 years. तो डबल बर्डन से लेके हम अब ट्रिपल बर्डन पे आ गए, जिसमें वी हैव अंडर न्यूट्रिशन. जब भी हम मैल न्यूट्रिशन के बारे में बात करते हैं, बहुत सारे लोग अंडर न्यूट्रिशन ही कहते हैं, लेकिन इंडिया में अंडर नरिश्ड पीपल में भी अगर फैट मास ज्यादा हो और लीन मास कम हो, उनमें सारे वो प्रॉब्लम्स हो सकते हैं जो ओबीज इंडिविजुअल्स में होते हैं. तो इसीलिए हमारा फ्रैंक ओबेसिटी और बीएमआई में नॉट बी अ ग्रेट मेजर. कभी कभी वेस्ट हिप रेशियो या वेस्ट का सर्कमफ्रेंस से भी हमें जानकारी लेना पड़ेगा कि इनमें ओबेसिटी के कोई लक्षण है या नहीं है. सो दैट्स अ वेरी बेसिक थिंग दैट वी हैव टू लुक एट. सो द ट्रिपल बर्डन, और ऐसा भी हो सकता है कि देयर इज आल्सो अ पॉसिबिलिटी ऑफ द सेम इंडिविजुअल बीइंग BMI wise normal, but will have all the problems that otherwise an obese individual or overweight individual would have. And in both these cases, there is a likelihood that they have deficiencies of several vital actually create a different scenario and a third burden. Next slide, please. Next slide. Yeah, if you see this, this is about the overweight and obesity in women in just last 5 years. I mean, the latest data that we have is of NFHS 5, और उसके बाद आपको NFHS 6 भी आने वाला है अभी. I think it will come sometime this year or early next year. तो आपके 5 years में आपके हीट मैप अगर देखेंगे, इंडिया के सारे डिस्ट्रिक्ट्स हैं जहां जहां विमेन में ओबेसिटी बढ़ता जा रहा है. जहां येलो है वहां कम है, ऑरेंज है तो ज्यादा बढ़ रहा है, और बहुत ही डार्क अगर रेड में दिख रहा है तो वहां बहुत ज्यादा है. तो यू हैव सीन द ट्रांजिशन बिटवीन द डिस्ट्रिक्ट्स फ्रॉम 2016 to 2021. You can see how the yellow districts have become orange, more and more orange districts have become red, and red ones have become dark maroon. Like, we assume that, some states which are economically backward like Odisha or Jharkhand may have very, very or no obesity or overweight at all. But if you see, all these do have problems that are very, very serious, and then they are also moving. Women's obesity, I've just taken an example. Women's obesity is becoming higher and higher. Next, please. Next slide. Yeah, this is a disturbing factor. All the NCDs, non-communicable diseases that are related to children, are also very high. If you see CNNS data, the Comprehensive National Nutrition Survey data, you can see that 5 to 9 years और 10 to 19 years दोनों में भी, जैसे कि प्री डायबिटीज हो, हाई ट्राइग्लिसराइड लेवल्स हो, या सीरम क्रिएटिनिन ज्यादा होना, या हाइपरटेंशन भी इतना कि 10 से 19 के बरस के जो बच्चे हैं, जिनको हम एडोलेसेंट्स कहते हैं, किशोरी अवस्था में जो होंगे, उनमें भी आप अगर देखेंगे तो 5 से लेके 10% तक हाइपरटेंशन भी बढ़ रही है. उसके साथ साथ हाई एलडीएल और लो एचडीएल भी बहुत ज्यादा देखने के लिए मिल रहा है. Of course, diabetes is there, but pre-diabetic conditions are very, very high. So these are some of the issues that are very, very concerning to us. इसीलिए इस साल पोषण माह में गवर्नमेंट ने ओबेसिटी पे ध्यान दिया है. ओबेसिटी इज वन ऑफ द वेरी इंपॉर्टेंट थीम्स, और इसी पोषण माह में चलते चलते हमको स्वस्थ नारी सशक्त परिवार योजना जो बनाई है, उसमें भी सारे एनसीडीज के लिए स्क्रीनिंग जो चल रही है, इसका भी एक उद्देश्य है कि हमें पता चले कि कितने एनसीडीज का कितना गहरा हमारे इकोनॉमी और कंट्री पे प्रभाव होने वाला है. नेक्स्ट प्लीज. देन यू सी द ओबेसिटी प्रिविलेंस. अगर यही रेट पे ओबेसिटी बढ़ता जा रहा है, एक स्टडी के हिसाब से आपको 2035 तक आप ब्लू लाइन, लाइट ब्लू लाइन और येलो लाइन देखिए, बॉयज और गर्ल्स में कितना रैपिडली आने वाले 10 सालों में ओबेसिटी बढ़ने वाला है. सो दिस इज समथिंग वेरी, वेरी कंसर्निंग फॉर अस. नेक्स्ट. इसमें बहुत सारी चीजें हैं. लेकिन मोस्ट इंपॉर्टेंटली मॉडिफाइबल रिस्क फैक्टर्स जिसको बोलते हैं, उसमें जेनेटिक फैक्टर्स होंगे और स्ट्रेस लेवल्स होंगे और स्लीप पैटर्न्स होंगे, सारे ओबेसिटी और नॉन कम्युनिकेबल डिजीज के लिए रीजंस हो सकते हैं। लेकिन जो मॉडिफाइबल रिस्क फैक्टर्स जिसे हम कहते हैं, दोज आर द वंस दैट वी कैन मॉडिफाई, हम जिसे ठीक कर सकते हैं, वो ठीक कर सकते हैं। जैसे ऐसे मॉडिफाइबल फैक्टर्स है कि डाइट, अपना डाइट जो खाते हैं हम, और अपना फिजिकल एक्टिविटी, और अपना स्लीप पैटर्न, और अपना स्ट्रेस लेवल कम करने की कोशिश जो हम कर सकते हैं वो। Giving that as the background, let me just come to the recommended dietary allowances that NIN proposes, our institute proposes. This is very number intensive book which gives recommendations as to what each individual per the physical activity level and by the physiological status that the person is in, what is the extent that of various nutrients that one person has to consume. उसमें 3 तरह के recommendations दिए गए हैं, जिसको एक RDAs कहते हैं, recommended dietary allowances, which is also 97 percentile. अगर RDAs meet करेंगे तो 97 percentile of individuals will have enough or even more than what is required for nutrients. And EAR का मतलब है at least 50% of the healthy population के लिए जितना बस होगा उतना है। और ये सारे बहुत टेक्निकल चीज है, बट जनरली टू अंडरस्टैंड, जो न्यूट्रिएंट जितना आपके एज और फिजिकल एक्टिविटी के हिसाब से आपको खाना है या लेना है, इसमें दिया गया है। और पैरेलली हमारा एक और भी डेटाबेस बनती है हर 10-15 साल में, और आरडीएस तो हर 10-15 साल में बनते हैं, लेकिन फूड कॉम्पोजिशन डेटा टेबल तो 2-3 डिकेड्स में एक बार बनता है, लेकिन 20-30 इयर्स में। तो पिछली बार 2017 में बना है। इसमें सारे 500-600 जो रॉ फूड्स होते हैं, सारे देश में खाया जाते हैं, जो पॉपुलरली कंज्यूम किया जाते हैं, those foods have been analyzed and their nutritive values and proximate principles have been given in this in terms of numbers. ये भी डेटा है और ये भी डेटा है, लेकिन इसको कैसे लेना है to help ourselves to be healthy? That is the question. To answer that question, NIN usually brings out, after revision of RDAs, something called dietary guidelines for Indians, which are simple, practicable suggestions for healthy Indians to continue to be healthy and to prevent non-communicable diseases, including overweight and obesity. Today, I will cover the important aspects of the dietary guidelines, which become the policy basis for all the policies in the country. कि dietary guidelines के हिसाब से ही आपको the 2000 किलो कैलोरी का लिमिट लेके फूड लेबल्स बनते हैं। डाइटरी गाइडलाइंस के हिसाब से ही आपको गवर्नमेंट पॉलिसीज बनते हैं कि डाइवर्सिटी कैसे लाना है, और व्हाट आर द फूड्स दैट वी हैव टू एनकरेज पीपल टू कंज्यूम। ये सारे आपको पॉलिसी लेवल के रेगुलेशंस मोस्टली बेस्ड ऑन डाइटरी गाइडलाइंस एंड आरडीएस पे होते हैं। नेक्स्ट स्लाइड प्लीज। So these are the dietary guidelines 2024. They are available for everybody's use in short versions and long versions in nin.res.in. ये हमारा वेबसाइट है, और जस्ट टाइप ICMR नेशनल इंस्टीट्यूट ऑफ न्यूट्रिशन गूगल में आपको वेबसाइट जहां मिलेगा, वेबसाइट पे जाइए, होम पेज पे आपको ये सारे डाउनलोड करने के लिए मिलेंगे। नेक्स्ट प्लीज। या दीज आर द 17 गाइडलाइंस। दिखने में 17 है, एक एक गाइडलाइन फिर आप देखेंगे तो एक चैप्टर जैसा उसको इजीली अंडरस्टैंडेबल लैंग्वेज में उसको एक्सपैंड किया गया है। एंड एवरी गाइडलाइन हैज द रेशनल व्हाई वी से यू शुड ईट वैरायटी ऑफ फूड्स, व्हाई वी से एंश्योर extra provision of extra food and health care for pregnant women, why we say eating plenty of vegetables and legumes is important. तो हर एक के लिए साइंटिफिकली रिसर्च्ड एविडेंस से लेके कल आउट करके उसको सिंपल लैंग्वेज में जो सबको समझ में आएगा उसमें देने के लिए कोशिश कर रहे हैं। तो ऐसे 17 गाइडलाइंस है, और 17 गाइडलाइंस के एक एक गाइडलाइन का एक चैप्टर होगा। चैप्टर इज इजीली अंडरस्टैंडेबल विद पिक्टोरियल्स। अगर पूरा चैप्टर पढ़ना आपको मुश्किल होगा तो इट इज इनफ इफ यू रीड द फर्स्ट गाइडलाइन एंड द टॉप रेशनल 3-4 लाइंस का रेशनल रहेगा, और वो चैप्टर के एंडिंग में आपको सिर्फ पॉइंट्स टू रिमेंबर रहेगा, ऐसे पॉइंट्स जो आपको ये सारा गाइडलाइन के बारे में डिटेल्स देंगे, और आपको जो अपने आपको याद रखना है और प्रैक्टिस करना है। नेक्स्ट प्लीज। So the first guideline, it says no one food is rich in all nutrients, so we need a variety. So diet diversity is the key in the first guideline. And also low cost, locally available foods. Aapke foods to be nutritious need not be exotic and very rich. And also recommendations of calories from sugar, especially because we are talking about HFSS foods. शुगर के लिए कोई रिकमेंडेशन इस बार डाइटरी गाइडलाइंस में हमने नहीं दिया है. Earlier we used to say sugar can be about 50 grams in a day. That is about 10% of the total calories that one takes in a day, assuming that an average individual needs about 2000 kilocalories. Of course, sedentary women need much lesser, men need much lesser, but nevertheless we take 2000 as a regular cutoff, because it's not a cutoff, regular level that we suggest the minimum calories and respective nutrients for, because it is very easy for people to understand. So the calories, if you your total meal in a day has to give you, say diet in a day has to give you 2000 kilocalories, then that 2000 kilocalories में से कम 10% पहले हम कहते थे, but people thought minimum 10% calories should come from sugar, and then they used to show sugar as an RDA, required dietary allowance of 50 grams a day. That's the reason why this time we said it is not recommendation. Our recommendation is no sugar is best, but if you still want to have sugar, keep it under 5% of total calories. If your total calories required for you in a day is 1600 calories, you have to calculate that it should be only 5%, which is like not more than 80 calories coming from sugar, which means you should not have more than 20 grams in a day. So that's the assumption. And for 2 year, less than 2 year children in complementary foods, no requirement of sugar at all is the requirement, is the thing that we've suggested, because sugar is one of the most addictive products. It is said to be more addictive than cocaine itself. So to initiate children on complementary foods with sugar will actually make them get used to sugary foods, and then their craving for sugar may go up as they grow. And the sugar is a cultivated habit, sugary food eating, sweet eating. So that cultivated habit, if it can be minimized during young age, आगे बढ़ते बढ़ते उसका असर ज्यादा बच्चों पे नहीं रहेगा, क्योंकि शुगर खाना वो कम करते हैं. नेक्स्ट प्लीज. सो डाइवर्सिटी में हमने ये भी अर्नब प्लीज अलर्ट मी व्हेन आई हैव टू स्टॉप. ओके, देयर आर 10 फूड ग्रुप्स वी सजेस्टेड. ये 10 फूड ग्रुप में से आपके डाइट में या हर एक मील में आप कम से कम 5 to 7 फूड ग्रुप्स ला सकेंगे, तो यू कैन easily say that your food is diverse or your diet is diverse. Okay, वो भी अगर समझना मुश्किल है तो नेक्स्ट स्लाइड प्लीज. ये माई प्लेट फॉर द डे हमने बनाया है, जिसमें आपको एक सारा दिन में आपको जो भी खाना खाना है, अगर आप एक प्लेट में रॉ फूड्स के तरह आप उस पर रखेंगे, तो ये ऐसा कुछ दिखना है 2000 किलो कैलोरी का डाइट के लिए. उसमें आधा प्लेट आपको भरा हुआ रहना चाहिए सब्जी और फल के साथ. Fruit and vegetable should occupy at least half of your plate in volume. Don't go by the fruits that are displayed there. Take the fruit that is locally available, that is cheap, that is seasonal. That is very, very important. Apart from that, you also have to have 400 grams of 400 grams of vegetables. Vegetable का मतलब आलू, प्याज, टमाटर नहीं है. Vegetable का मतलब और broad based vegetables that are available seasonally, locally. And इसमें अगर green leafy vegetables भी रोज है 100 grams, 50 to 100 grams in a day, not every time. That is very, very important. और सीरियल डेंस जो कंजम्पशन हमारा कंट्री का है, उसको अगर हम सिंप्लीफाई करना चाहते हैं, वी कैन हैव 40 to 50% of our 250 grams of cereal recommendation coming from coarse grains or millets. It is also not required. Most people have a fad of replacing all the regular staple cereal that they are consuming with only millet. But if millet is not consumed the way it has to be consumed, if millet is also processed, if millet is malted, it may not serve any purpose. So coarse grains, little unpolished ones, and also millets, the way they should be consumed should be about 40 to 50% of your staples cereal requirement in a day, which is about 250 grams. So you can safely assume in a day you can have about 100-120 grams of millet or coarse grain. You can continue to have your rice or wheat or whatever is your staple in whichever part of the country you are. There is no need to demonize rice or wheat. Just ensure that it is not very highly polished. Okay, and then you will also have nuts in a day. Nuts and legumes are very, very important, and oil seeds. Mainly oil is shown to be a villain by many people, but you require fats, visible fats. We require about 30 grams a day, but the trick is in making these fats combination. If you have only one variety of fat, you may not be getting all that you require. I'll come to that later. But more than what is required, if you have fat, then it is called high fat diet. In a day, if your total calories are coming from more than 15% of your total calories are coming from only added fat, then it could be little, you could say that your diet is high in fat. Similarly, protein rich foods like pulses, dals, and egg and meat and fish are very much recommended. And if you are a meat eater, first preference should be fish. Good news for Bengalis and Malayalis. So fish is the first preference. Second is egg, and then going for red meat. Then poultry, and then going for red meat. So that is the recommendation. And milk, India is the highest producer of milk, but unfortunately, Indians consume very less milk. So we have to we have to ensure that 300 ml of milk or milk products like dahi and others are consumed. Next. तो ये अगर हम रिकमेंड करते हैं तो इंडिया में लोग कैसे खा रहे हैं, 2014 के स्टैटिस्टिक्स लेके इसको हमारे इंस्टीट्यूट ने बनाया. हमारे प्रीवियस डायरेक्टर जो डॉक्टर हेमलता थे उन्होंने बनाया. आप अगर देखेंगे व्हाट इंडिया ईट्स, यू कैन से दैट आधा अगर प्लेट में हम हरी सब्जी और फल रिकमेंड कर रहे हैं, आधा प्लेट रूरल इंडिया तो चावल या गेहूं का रहा है, बाकी सब आलू प्याज टमाटर से भरा हुआ है. नहीं है तो unfortunately about 40 grams is also coming from ultra processed foods like colas, like soft drinks, like sugar sweetened beverages, like bakery foods, like chips and others. So this is a very unfortunate situation. Look at milk. We are consuming very, very little milk. Next slide please. If you think urban area is any better, urban area is also not better. Urban area is also this. Unfortunately, the ultra processed food and HFSS food consumption in urban areas has increased a lot. In 2014, this was a status, or 16, it was a status. In 2025, it could be much, much worse. And we are waiting for our new Sampada studies data to come out by this year. And we'll also be able to tell you how much India is consuming in terms of sugar, fat, and salt. So that's a very sorry state. Next slide, please. So to define what is HFSS foods, NIN in the 15th dietary guideline has suggested this. If a solid food of 100 grams is giving you more than 250 calories, then it is high calorie food. And in that, if the salt is 625 mg salt, in 100 grams food, if you have more than 0.6 grams of salt and also fat, about 4 grams of fat or more than 4 grams of added fat, not the inner and fat, what is added जैसे कि तेल या घी या बटर, ऐसे कुछ फूड में ऐड करके बनाता है. अगर 100 ग्राम में 4% से 4 ग्राम से ज्यादा अगर आपको उसमें फैट या तेल मिला हुआ हो तो उसको आप हाई फैट फूड कह सकते हैं. अगर एडेड शुगर का मतलब सिर्फ रिफाइंड शुगर नहीं है, वो ब्राउन शुगर भी हो सकता है और जैगरी भी हो सकता है, पाम शुगर भी हो सकता है. ये सारे अगर 3 ग्राम से ज्यादा शुगर है, एडेड शुगर 100 ग्राम में, तो वो कहलाता है हाई फैट शुगर फूड. सिमिलर थिंग फॉर लिक्विड्स में अगर टोटल कैलोरीज फ्रॉम 100 ml ऑफ लिक्विड आपको 70 कैलोरीज से ज्यादा बढ़ रहा है तो इसका मतलब है वो हाई कैलोरी ड्रिंक हो गया आपके लिए. तो उनमें अगर सॉल्ट और शुगर जैसे कि टेबल पे दिया गया है, आप अगर उस लेवल से ज्यादा बढ़ गया तो उसका मतलब होगा कि वो HFSS फूड है. So this is something that nutrition students should learn and see and understand. Of course, world over, there is no standard definition yet for what is high fat, sugar, and salt foods. WHO and others are trying to come up with the definitions, but for operational purposes, Indian's dietary guideline has recommended somewhat like this. This is also being considered very strongly by FSSAI for inclusion in the school regulation, which demands that HFSS food should not be sold around 50 meters of school's vicinity. So hopefully this will get through from from FSSAI. If it is adopted by FSSAI, then definitely it will be a regulation soon. Next, please. Next. Yeah, among pregnant women, the dietary guideline 2, it talks about a lot of things, but very importantly, it suggests that HFSS foods during pregnancy should not be taken, because now emerging evidence from the world is showing that highly processed foods or high in fat and sugar and salt foods not only have impact on the gestational weight gain and the possibility of GDM, that is gestational diabetes mellitus, that is अगर वुमन का वेट बढ़ जाए और फीटस का वेट बढ़ जाए और जेस्टेशनल डायबिटीज हो तो फीटस को आई मीन द बेबी टू डिलीवर विल आल्सो बिकम very difficult for mother, and gestational diabetes is also a possibility that is there. So HFSS foods के साथ साथ टोबैको और अल्कोहल यूज का भी रेस्ट्रिक्शन दिया है, और हाई फैट शुगर एंड सॉल्ट फूड्स को कम करने के लिए या आपको जितना हो सके उसको कम करने के लिए इसमें रिकमेंड किया है, बिकॉज देर आर ऑल्सो स्टडीज अबाउट फीटल ऑरिजिन्स एंड प्रेगनेंसी आउटकम्स के बाद भी जो फीटल ऑरिजिन्स जो बच्चे के होते हैं दोज डिसीज ऑरिजिन्स फीटल ऑरिजिन्स ऑफ नॉन कम्युनिकेबल डिसीजेस, जो बच्चा बढ़ के बाद में बड़ा होने के बाद भी जो उसको एनसीडीज जैसे कि डायबिटीज, हाइपरटेंशन, कार्डियोवास्कुलर डिसीजेस और बाकी सब ओवरवेट, ओबेसिटी के साथ साथ और मेटाबॉलिक सिंड्रोम या हाई कोलेस्ट्रॉल, ये सब हो सकते हैं। ये सारे भी बचपन में या माँ के गर्भ में जब बच्चा होता है तभी प्रोग्राम हो सकते हैं। सो द फीटल प्रोग्रामिंग ऑफ अंडर न्यूट्रिशन से भी हो सकता है और ओवर कंजम्पशन ऑफ HFSS फूड्स भी हो सकता है। आजकल का डेटा वही दिखा रहा है। नेक्स्ट प्लीज। तो देन होममेड फूड्स, मैंने बीच में 2 गाइडलाइन स्किप किया है बिकॉज दीज गाइडलाइंस आर ऑल अबाउट initiation of breastfeeding, first 6 months of exclusive breastfeeding for children. That is not very relevant, because if you are giving that and not in that, simple thing is don't give any outside milk if the mother is able to feed the child. That is the first thing. And in dietary guidelines 4, which deals about complementary foods, बचपन में अगर कॉम्प्लीमेंट्री फूड्स घर का जो बना रहे हैं, अगर उसमें आप चीनी ऐड नहीं करेंगे तो बच्चे को चीनी ऐड करने का जरूरत नहीं है, और बच्चे को अगर चीनी ऐड करेंगे तो उसका आदत पड़ जाएगा बाद में जाते जाते। जब बच्चा एडोलेसेंट होगा या चाइल्ड होगा या अडल्ट होगा तब ज्यादा स्वीट खाने लगेगा, तो अवॉइड दैट। एंड ऑल्सो ये बहुत रूरल एरियाज में ये बहुत सारा आपको नोशन है कि बच्चे बहुत बिस्किट पसंद करते हैं और बिस्किट दूध का बनता है, और दूध वाले बिस्किट अगर देंगे तो बच्चा अगर कोई कॉम्प्लीमेंट्री फूड घर का बनाया हुआ नहीं खा रहा है तो बच्चे को वो बिस्किट को दूध में भिगोगे उसको खिला देंगे। ये बात बिल्कुल सही नहीं है, क्योंकि इसमें बहुत सारा फैट और मैदा और चीनी डलता है जो उसको डायरेक्टली HFSS बनाता है, और बेकरी के जो प्रोडक्ट्स है और बिस्किट्स जैसे प्रोडक्ट्स है उसमें सोडियम वाले एडिटिव्स जो बनते हैं उसमें रहते हैं, इससे वो हाई सोडियम भी बन सकता है। वी आर वेरी हैप्पी बेस्ड ऑन दिस गाइडलाइन, गवर्नमेंट ने आपको गाइडलाइन इशू किया हर ICDS और आंगनवाड़ी सेंटर्स को कि बच्चों के कॉम्प्लीमेंट्री फूड में जो 6 मंथ से लेके 2 इयर्स वाले बच्चे होते हैं वो कॉम्प्लीमेंट्री फीड में या अंडर 5 चिल्ड्रन के जो फूड देते हैं उसमें शुगर ना इस्तेमाल करें। एक चीज इसमें थोड़ा कटकता है कि इसमें ये बोला गया शुगर अवॉइड करे, कहीं हो सका तो थोड़ा जैगरी यूज करे। हमारे NIN के तरफ से जैगरी भी शुगर जैसा ही है, उसको जितना कम लिए उतना अच्छा है। नेक्स्ट प्लीज। So let me know if I am overstepping time, Arnab, because there are few more dietary guidelines. And then adolescents, if you take.
No, sir. Please go ahead.
Yeah,
Sir. This
go ahead.
no problem.
Yeah, show the slide. Put it in slideshow mode. adolescent next guideline is about adolescents and children, जिसमें उनको ओवर ईटिंग और इनडिस्क्रिमिनेट एडोलेसेंट एज में इनडिस्क्रिमिनेट डाइटिंग जो करते हैं, जो वेट लूज करने के लिए स्टेपल छोड़ देते हैं, कार्बोहाइड्रेट डेंस फूड्स छोड़ देते हैं और शुगरी फूड्स छोड़ देते हैं और अपने हिसाब से इनडिस्क्रिमिनेट डाइटिंग प्रैक्टिसेस शुरू करना लगते हैं, तो ये बहुत हानिकारक हो सकता है आगे बढ़ते बढ़ते। जैसे कि बहुत सारे बच्चे प्रोटीन सप्लीमेंट्स पे निर्भर करते हैं ज्यादा और उसको कार्बोहाइड्रेट से बैलेंस नहीं करते और विटामिन एंड मिनरल रिच फ्रूट एंड वेजिटेबल से बैलेंस नहीं करते, तो इसका भी बहुत सीरियस रिपरकशंस हो सकते हैं। और जो प्रोटीन रिच करके आपको प्रोटीन सप्लीमेंट्स मिलते हैं, वो सप्लीमेंट्स में भी शुगर और वो हाईली प्रोसेस्ड है और शुगर रह सकता है और उसको देख के आपको लेना अच्छा होगा। एंड एट द सेम टाइम डिस्करेजिंग एचएफएसएस फूड्स एंड यूपीएफ्स, जैसे कि स्नैकिंग टाइम पे या अदर थिंग्स, दैट इज आल्सो शुड बी अवॉइडेड in childhood and adolescence. And inclusion of diverse diets is stressed, and most importantly, it is not just enough to reduce HFSS foods or unhealthy foods, but it is also very important to increase fiber dense foods, protein dense foods, and fruit and vegetable, and also coarse grains. And at the same time, physical activity is the most important thing that needs to be taken into consideration. Next, please. Then next one is eat plenty of vegetables, because it is not just to reduce, not just enough to reduce high sodium foods, but it is also necessary to balance it with high potassium foods. Fruits and vegetables are very good sources of these. And if you cut down on sodium, it will be very good. But if you increase this, also it will be very good. Next, please. Then oil, as I said, trans fatty acids, government is taking all measures to avoid वनस्पति, आपको पता है हाइड्रोजनेटेड फैट्स जो घी के बराबर दिखते हैं, बहुत सारे मिठाई वाले इसको यूज करते हैं, उसमें ट्रांस फैटी एसिड्स बहुत ज्यादा होते हैं, लेकिन अब 2% से लेस ट्रांस फैटी एसिड्स का मुहिम गवर्नमेंट ने चलाया और अभी बहुत सारे ट्रांस फैटी एसिड्स कम हो गए हैं। फिर भी रिपीटेड हीटिंग ऑफ ऑयल से आपको ऑयल में सैचुरेटेड फैट बन सकता है और कभी कभी ट्रांस फैट भी बन सकते हैं, तो इसको आप कम करना है। पॉमोलिन जैसे ऑयल्स में थोड़ा सैचुरेटेड फैट ज्यादा होता है, कोकोनट ऑयल में ज्यादा होता है। It is not, we are not saying that you should avoid saturated fats, but you should balance them with good unsaturated fatty acids like PUFA and MUFA, which are high in different kinds of oils. तो सारे ऑयल्स के हर किस्म के गुण हम आपको मिलना है, तो आपको ऑयल्स को कॉम्बिनेशन में लेना पड़ेगा, जैसे कि मस्टर्ड ऑयल, कॉटन सीड ऑयल, groundnut oil and rice bran oil may be good in N3 PUFA, whereas sunflower oil, safflower oil, and other oils can be rich in N6. So you need a combination of N3 and N6. There are different ratios that people suggest, 1:5 and things like that. I don't want to complicate, but what I am trying to say is, if you are using oil, you should use definitely some fatty acids and oils in your daily diet. That should be about 30 grams a day per individual per day. अगर ये 30 grams में 3 अगर अलग अलग किस्म के ऑयल आप लेते हैं, तो if people ask you, can we eat ghee, can we eat butter, no problem, they can eat, but if they can confine it to 1/3 of their visible fat requirement in a day. इसका मतलब है अगर 30 ग्राम का अलावेंस है, तो 10 ग्राम के अंदर आप अगर घी और बटर एक दिन में ले रहे हैं, उससे कोई दिक्कत नहीं होगा। और बाकी के 10 ग्राम आपको मुफा चाहिए, जैसे कि मुफा सनफ्लावर ऑयल, सैफ्लावर ऑयल ऐसे में मिलता है, और तीसरी किस्म का 10% आपको पूफा के ऑयल से मिलना है, जैसे कि मस्टर्ड ऑयल एंड ग्राउंडनट ऑयल एंड राइस ब्रान ऑयल एंड soya oil and things like that. So this is how you have to balance your fats. And deep fried items, repeated reheating of oils, this should be discouraged, and rules and regulations are also being framed for this. Repeated reheating of oils is being looked at in many compliance visits by FSSA officials. But there are also emerging problems that what is used and reused in restaurants is passed on to the street food vendors, and the street food vendors tend to use them at high temperatures for a long duration. So it is better for us to avoid deep fried items outside, or if you want to consume them in minimum, because taste is something that drives our choice. So let it be, but we'll have to minimize consumption as far as possible. Next, please. Then it is protein. Protein supplements are not required. Indiscriminate protein, as I said. Try to source protein from food sources, and there are several food sources. About 0.66 to zero point 0.8 grams per kg body weight for an individual is all right for a normal moderate activity person. For a highly active sports persons also, about 1 gram per kg body weight of protein is enough. You plan it accordingly. सप्लीमेंट का जरूरी है जब आपको प्रोटीन का डेफिशिएंसी हो. Otherwise, protein supplements are not required. It is better to get it from good sources, and also it suggests that vegetarians can also source adequate protein by arriving at a very good combination of 1 is to 3. 3 parts of carb-rich foods and 1 part of protein-rich foods like pulses and rice, or pulses and millets, or pulses and coarse grains can help you get the good combination of essential amino acids. Next, please. Obesity again is a focus on 9. There they are saying not just monitoring your weight but also waist circumference, which is very important, and also avoiding soft drinks, sugar sweetened beverages, HFSS foods is a strong recommendation. Have better fiber rich foods and also phytonutrient rich fruits and vegetables. Next, please. Then there is importance of physical activity, which is an important factor for obesity. I need not go into detail, but in a nutshell, 35 to 40 minutes of physical activity for adults and about 60 minutes of physical activity for adolescents. Physical activity, intentional physical activity other than the regular activity that we do, is very, very important. And in that, if you can do muscle strengthening, stretching, those kind of activities, it will be extremely useful and helpful. Next, please. Then restricting salt, not more than 5 grams a day. And if people think Himalayan salt अच्छा है, सेंधा नमक अच्छा है, काला नमक अच्छा है, तो रिफाइंड नमक अच्छी नहीं है, तो उसको बगल में रख के ये लेना शुरू करे, उसमें कोई रेशनल नहीं है. सॉल्ट में बहुत डेंजरस चीज होती है सोडियम, अगर ज्यादा लेने से. तो अगर सोडियम इन सारे अलग अलग किस्म के नमक में भी है, सेंधा नमक में भी है, हिमालयन नमक में भी है, पिंक सॉल्ट में भी है, और हर किस्म के उसमें भी सोडियम इज अ फैक्टर. तो आपको सोडियम अगर कम करना है तो they only differ from 97, 95, 92%, but maximum content in all these is sodium. So it is better to restrict any salt to 5 grams a day, and fruits पे salt छिड़कना, all these things can be avoided. Don't have a salt dispenser on the table. जो खाना में salt डलता है उसके बाद आप salt ऐड करना अगर restrict कर पाएंगे तो उससे बहुत आपको effect और benefit मिल सकता है. And more salt is directly associated with high hypertension and also other cardiovascular diseases. Next, please. Yeah, this is the key chapter related to HFSS foods. I suggest all nutrition students to go through this chapter very carefully. Kahin bhi in the world, there is no definition of what is HFSS foods or what is ultra processed food. Together, what they make, UPF and HFSS foods. So there is ultra processed food definition by Carlos Monteiro, which is called NOVA classification, which is largely used. It talks in terms of the extent of processing, but it doesn't talk in terms of compromise of nutrients. It also says the extremely processed ingredients आप अगर यूज कर रहे हैं जो फैक्ट्री में बनते हैं और घर में ज्यादा किचन्स में, ट्रेडिशनल किचन्स में यूज नहीं होते. आजकल हम घर में भी बहुत सारा बनाते हैं. We think whatever we make at home is very, very good, but we tend to use ultra processed ingredients in them. जैसे कि फ्राइड राइस आप बना रहे हैं तो ketchups, sauces, and all those things you are taking which are ultra processed ones, and sometimes even MGM, monosodium glutamate, MSG, that we take, all are ultra processed ingredients. लेकिन घर में बना रहे हैं तो घर में अगर बनाएंगे ultra processed foods, ultra processed ingredients use करेंगे, तब भी that food can be high fat, sugar and salt and ultra processed. That is what Carlos Monteiro says about UPF. But HFSS food के लिए जैसे मैंने फर्स्ट में आपको एक टेबल दिखाया था, 250 कैलोरीज से ज्यादा अगर सॉलिड फूड हो तो उसका हाई कैलोरी बता सकते हैं, और बाकी सब फैट और शुगर का लेवल भी मैंने दिया है। उसको दोनों को मिला के ABCD कैटेगराइजेशन किया है। A इज मिनिमली प्रोसेस्ड, लेकिन A1 इज मिनिमली प्रोसेस्ड, मिनिमम HFSS। A2 इज मिनिमली प्रोसेस्ड बट लिटिल HFSS। A3 इज मिनिमली प्रोसेस्ड बट हाई HFSS। जैसे कि गन्ने का जूस हो, the processing is very very less. So but it is only sugar, there is nothing else. Then it is minimally processed food, it cannot be highly healthy, it can also be unhealthy. Similarly, there is C2 C3 foods which are like highly processed, but they can be really good. Like nowadays you get idli batter outside, or you get dosa batter outside. They are cereal pulse combination, but people cannot make batter at home. It is made at an industry level with some additives to preserve it for a longer time. It can still be not HFSS and still serve. So is दोनों categories को consider करते हुए one attempt has been made in this guideline to define HFSS and UPF foods. So this is just an example. You should go through in detail. Avoid HFSS and ultra processed to be healthy. Next one, please. This is the statistics of the country. Next one, please. Per capita income आप अगर देखेंगे, per capita expenditure on foods, पिछले 10 साल में expenditure on cereals कम हुए हैं, लेकिन expenditure on ultra processed foods has increased. That is what this graph says, both in urban and rural areas. Next, please. Then the last guideline is about label reading. There are a lot of countries' dietary guidelines anywhere in the world. No country has anywhere till now introduced reading label information as a dietary guideline. India is the first country. That is because reading label will make you help you make informed food choices. So you have to read the contents. Don't ask me whether all the labels are correct or not. You should start reading first, then you can question that. So that's what the food farmer has done. If you've seen Revant questioning big industries, he's read label of Bonvita, which was there in existence for 50 years. He said, इसमें तो nutrients है करके ये लोग claim कर रहे हैं, लेकिन 30% तो इसमें sugar है. तो he said there is sugar in it, and then उसके ऊपर बहुत सारा arm twisting हुआ है, इंडस्ट्री ने केसेस ठोपा है, सब कुछ किया है, लेकिन फाइनली ही वन. Bonvita has had to reduce sugar by 14%. तो अगर आप रीड करना शुरू करेंगे तो आप भी क्वेश्चन करना शुरू कर सकते हैं. That's the reason why you have labels. Next, please. These are dietary guidelines. In general, have a policy implication. Based on this, we have come up with sugar boards and fat boards, which most of the CBSE, ICSE, and also health ministry has indicated all government and other schools and colleges and government offices to put up. लेकिन इसका ट्विस्ट किया गया है मीडिया में कि जलेबी और समोसा का भी टारगेट कर रही है गवर्नमेंट, क्योंकि ये स्ट्रीट साइड पे बनते हैं, बहुत सारों को लाइवलीहुड देते हैं. इसका मतलब ये नहीं है कि समोसा जलेबी ट्रेडिशनल फूड्स है तो वो सही है. समोसा जलेबी अगर डीप फ्राइड है और उसमें तेल है या उसमें चीनी है या उसमें नमक है, it is as unhealthy as that is made outside, but it may be safer if you make it at home or traditionally make it at home. So the main skill that everyone has to know is whether you make it at home, outside, restaurant, street food, any food that qualifies to have high fat, sugar or salt is HFSS and will have similar impact on the health. इसका मतलब नहीं आप घर में ट्रेडिशनल स्नैक एक बनाएंगे, उसमें अगर नमक ज्यादा रहेगा तो वो हाई नमक की है. It is high salt food only. There is no other go. So that is what you'll have to look at. Are the slides done, or is it? I think there are 2 or 3 more slides. So in a nutshell, what we are trying to say is to discourage HFSS foods. We are running something called a Let's Fix Our Food movement, which is a consortium of lot of like-minded research and policy making bodies. And then am I audible? I hope I'm audible.
Yes, sir.
Yeah, okay. Well, I don't need the last few slides, Arnab, that's okay. It says that HFSS foods we are concentrating on 5 straight policy recommendations. One is to bring front of pack nutrition labeling because people have difficulty reading the numbers. Can we represent the healthiness of the food in terms of a symbol on the front, either as a star or as a color coded one, as red or green or black or whatever? So that is one of the things that we are requesting for. Then to raise taxes on unhealthy foods, unfortunately, the recent GST has taken SSBs into consideration very well. SSBs have, sugar sweetened beverages have highest tax bracket, that we are very happy about. But some of the namkeens and some of the foods have come down on tax, but probably we are hoping government will take that also into consideration as more and more science and information emerges. And after that, nutrition literacy for school children and adults and adolescents is very, very important. Without that, however literate you are, if you are nutritionally illiterate, you may not be able to do justice for yourself or choose right kind of foods. We are asking for more efforts to increase these. And finally, double duty actions and also curbing advertising and marketing of unhealthy foods. You don't know how much companies spend on unhealthy foods marketing. They market it in such a way that you think giving chocolate is a great thing, that if Rakhi comes, Diwali comes, Dashera comes, your gifting has now changed from earlier fruits and traditional snacks to you are giving chips, you are giving chocolates, you are giving meetha, you are giving namkeen and things like that, which are HFSs. So those things are happening because advertisement puts it to you in such a way that you think doing this is the greatest thing, doing thing is the cool thing, doing this is a very, very interesting thing. So to restrict such kind of advertisements which are likely to mislead people, likely to mislead people with unnecessary claims, is what the demand is on. Of course, there is a lot of good regulation that we already have in terms of claims, and claims can be made on the packaged food only based on. Go to the last slide. It's okay. Last few slides. Next. Yeah, this is how you can see. आप अगर चाइल्ड का फूड एनवायरनमेंट देखेंगे, स्कूल में, कम्युनिटी में, डिजिटल मीडिया में, ये सारे एडवर्टाइजमेंट्स आपको कहीं ना कहीं मिलेंगे. They think these are the foods that are available, that these are cool foods to take. That's the problem that you usually encounter. Next, please. Next. Okay, next. You can leave it. Understanding and perception, the way forward. You should know what is healthy or unhealthy food, whether made at home or outside. We are not doing favor by giving anybody HFSS foods. That has to be reduced. Everything cannot be reduced only by policy, because food is an individual's choice. So, जब आपका you had this sugar boards and salt boards, you have seen many people saying that we have a right to eat what we want, who's the government to decide? That is also in a way true, but government also has a responsibility. As individuals, we are responsible for our own health and our own family also. So it should work both the ways. We should know what is healthy, what is unhealthy, wherever we are taking. It's on not only a child, this is also applicable for everyone. Next, please. Schools should not sell HFSS foods, and skills that we need to have is reading labels, knowing safety of the foods, and sourcing from the best possible locally available foods. And we should have nutrition as a skill building activity in the curriculum, not just as lessons and exams. We should have skills to read labels, skills to choose foods, skills to choose the best ones that are available within our vicinity. Next, please. And parents, people, children, peers have responsibility to build everyone's food environment. Next, please. Yeah, this is let's fix our food I was saying about. Next, please. Next, please. So these are the policy actions we are looking for. Double duty actions. Back. Double duty actions, taxation on high fat, sugar, and salt foods, front of pack labeling for easy understanding, increasing efforts for nutrition literacy, and bringing out stricter laws for combating advertising. Because if you see, South Africa recently has banned using children or targeting any food advertisements to children, any food. And Australia and Chile and Brazil also have come up with it. UK has banned using children for advertising, and also targeting foods to children. Any food, whether healthy or unhealthy, should not be advertised for children during children's prime time viewing time. And also, children below 12 years cannot be used as models as anything else. In some of the countries, these regulations have come up. I think it's time for us also to think in those lines. Next slide, please. Thank you very much for your attention. I'm open for questions if there are any. I'm sorry for the technical glitch and the delay in my talk, and also I apologize if I have overstepped my time.
Madam Duralakshmi, please mute yourself. Anjana, I think Anjana, I think from your organization, could you please?
Yes.
Yeah.
Yes.
Sir. So now it was just a crystal clear presentation, as always. Means whenever you present something, it opened up new ideas, and means we were fortunate that we got you in our classroom session as well. And I think that across the India now they got this opportunity to interact with you. And as you correctly said, that from intrauterine life to means catch up growth and then later stage of life, everywhere the HFSS food, these are impacting our health and nutritional well-being. So it was a great learning experience for all of us. And now it is time to introduce for formal Q&A session and vote of thanks to our Sneha Sri Shaha madam. Or before introducing her, it's a great moment to welcome her here in this virtual platform, because one of the greatest method acting school, that is Konstantin Stanislavski, once said, the best part of an actor is to believe. Stanislavski is to believe that the first character one should have. And Snehasri madam, she believed on nutrition, education, and communication when nobody thought that this could be a area of research. And she is one of the pioneer who joined with Subba sir and their group, and then they started the read before you eat. That concept came out, and with the in Kolkata was the initial pilot study. That was the area of research, and they came out with a wonderful research, and she has been doing a great job as an assistant professor, inspirational academician. It's time to welcome on this virtual platform Dr. Sneha Sri Shaha madam, who is Dr. Subba sir's first PhD scholar. Madam, please go for the Q&A session and a formal vote of thanks for today's
Thank you,
event.
Arnab. I see only two questions as of now. I can see lot of thank yous and lot of views also on the Facebook Live. There is one question I take that to sir, that can you clarify whether sugar and jaggery are separate, and is there any paper? I think we all know about the processing from sugarcane, but if you sir, if you want to add at least one line about your comment on sugar and jaggery consumption.
Sorry, I missed that.
Yes, sir.
There was
Somebody is
network error.
asking, is there a paper or article to say that sugar and jaggery are almost same? That was the question.
No, there need not be any paper. Just look at what is content sugar or jaggery. It's the same. Source is same. Anything which only thing that differs is the process and the refining.
Yes, sir. For the person asking, I think you have your answer that it is only the processing from the major food source. We also have one more question, but I don't think it is relevant with the today's topic, soybean intake and the sperm quality. So we will postpone that question for the next session when we have a relevant topic. coming back to today's session, sir, I really do not have enough
So-
words, as you know, that to say that thank you. And for viewers and participants in this program, I want to tell that it took less than one sentence when I called him and I said, sir, we want to conduct a program.
Same in both.
So,
You don't
so
need a separate research or paper on that.
yes, late notice, and it was a very little time when we contacted him, and he encouraged this collaboration and also provided us all the support needed to conduct this meeting. And also, I would like to thank Shanjana and Kajal on the back end who actually supported during the entire meeting. And as I was saying, we really get
Oh.
very little chance to talk to public policy maker, and their DAY is actually doing a really good work to conduct practical knowledge transfer to the community. So I think this is a wonderful collaboration which should go ahead in the future as well. I would also like to thank Arnav Chatterjee from Asansol College to collaborate and conduct the entire session, and also people who have joined us in the Zoom meeting and Facebook Live.
Ma'am, sir just called me. He said that he is not being able to connect again because there is a
Yes.
network issue and
Yes, I thought
data
so.
also over. So sir is telling that it's very
Yes,
difficult to connect
I
again.
thought so. But I would, before ending the meeting, I would really like to say three things that, today, all the things that he said, it was really bold take on the policies that are being made and will be coming in next 1 or 2 years. He also clarified NIN's policy and stand on those issues, because, in social media, there are flooded information about this information, this myths, packaged food, HFSS, labeling, and all this terminology, and there is a lot of confusion happening. So anybody who has little interest, if you can go back with the session, you would see what is enhanced stand that we all need to know before reading the dietary guideline, while reading it, and also to make a diet chart. I think we all need to be aware of such classifications, and also it's a really humbling experience, for especially for me and Arnav, and students who are joined here, Anjana, those who have we have shared the educational journey together, that to invite sir on this platform. And it was a very prompt response on his side. So he's not just a teacher, he's actually a mentor, and we can rightly say he's a friend, philosopher, and guide. Very fortunate to have him in this session. So I think that would be today's program, and it's really late and a Saturday evening, so it's an honor to have all of you with us. Thank you.
And here we would like to inform you all, that those who are attending from Bengal, that NSI West Bengal chapter is means already ready to launch. We have discussed with sir. Almost the EC members has been finalized. Those who are going to represent NSI West Bengal chapter. Soon we are going to come out with the all portfolio members' name, and you will means going to get all the relevant information about the NSI West Bengal chapter. So thank you once again on behalf of Day, Asansol Girls College, and Udaynarayanpur Madhabilata Mahavidyalaya, Snehasri Madam, Indrajit Sir, and the entire Day team for hosting. And not the last but not the least, that is our extraordinary audience. More than 400 people joined over Facebook Live and in our Zoom call. It is a great moment to acknowledge all of you for joining with us in this National Nutrition Month and Dietitian Update series. And this is just the beginning, because NSI West Bengal chapter is going to launch many webinar series which are going to help our students as well as the dietitian community and academician as well. We would like to thank Binota Madam from Calcutta University, Anindita Chakraborty Madam from Maharani Kashishwari College, and all the respected senior professor in West Bengal chapter. So it is a great moment that without your support and encouragement, we could not forward. So it is a great moment to acknowledge once again all of you. And Day team, back in Shukonna, Kajul Madam, for your relentless support, flyers, and everything. This link and the generation and the propagation and the advertisement, the branding, everything happened so well. I would like to congratulate and thank from bottom of my heart. And Anjana for joining with us from Kerala. Anjana was our MSc junior, and Anjana and her team. It's a great, moment to welcome you all in this NSI West Bengal chapter and day. Together we try to do something, and I think this academic journey will be continued because we need all of your help. So good night. So we are sincerely thanks to all of you. So day team, I would request you to close the session. And once again, good night. And I think this is just the beginning, miles to go before we sleep. Thank you all. Thank you,
Thank you.
Snehasri Madam, once again for joining and for taking that great initiative to host the NNM on virtual platform. Thank you.
I joined. If I'm audible.
Yes, sir.
Yes, sir. Yes, sir.
Okay. Thank you for everything. Sorry if there were any questions. One request I had was to please initiate the Kolkata chapter, take it seriously, or maybe Bengal chapter as you want to call it. And by as early as possible, maybe by the end of this month, if you can just send out the minutes and the body that you have selected, and then share it with the headquarters. It will be nice. We can get it done in the EC that will happen in the Nutrition Society of India meeting on 14th and 15th November in Hyderabad. So you're all welcome to register yourselves and participate. Uh, and we will be in touch. We want Bengal to be very active in terms of the Nutrition Society of India, and you are all our senior and also our own students involved. Thank you all for this opportunity. Sorry for all the technical glitches that we've got during the time.
Thank you, sir.
I hope I
Thank
was
you
audible.
for joining in Saturday evening. That we know it's a lot for you in this kind of busy week, but thank you for accepting our invitation. Thank you, sir.
Thank you all. Thank you. Great work.
Thank you.
Thank you, sir. Thank you. So, thank you, day team. So, thanks. Good night, one and all.
Good night.
Bye.